National Black HIV/AIDS Awareness Day is today, and the Suncoast Community AIDS Network held an outreach event over the weekend providing HIV screenings while encouraging everyone to be proactive. Take a look.
So all I'm going to do is stick your finger, put it in the solution. I'm going to collect a sample of your blood here, and then within 15 minutes you'll know your results, okay?
Bruce Hanter, a 50-year-old resident of Sarasota's Newtown neighborhood, a predominantly African-American community, says he's taking advantage of the Community AIDS Network's HIV testing program because it's important for him to stay healthy.
All people should have HIV screening as part of their annual health checkup.
I'm going to poke you, okay?
Okay.
That's it.
It's just a simple touch, and you test it. I'm finished now.
Hanter's test this past weekend and Suncoast Community AIDS Network, or CAN, outreach event is part of today's Black HIV/AIDS Awareness Day. According to the Centers for Disease Control's website, African Americans experience higher rates of HIV compared to other races and ethnicities. In 2015, African Americans made up about 12% of the U.S. population, but accounted for 45% of new HIV diagnoses.
It really makes me sad to think about all of these African American, predominantly men, having much higher rates of HIV and AIDS and dying disproportionately because of it.
Dr. Lisa Merritt is Executive Director of the Suncoast Multicultural Health Institute. She says it comes down to disparity.
And it speaks to a lack of education and preventive efforts. It also speaks to a lack of access to care.
But through outreach programs like those offered by Community AIDS Network, people like Hanter are being tested. And he encourages all of us to do the same.
And don't be scared. There's nothing to be scared of.
Because, according to Merritt, knowledge is power.
We think that everyone needs to know their status, be informed of the importance of that, and the more that people are aware of that and have testing and have the proper counseling and education, this will help stem the tide of transmission.
And right now we're joined by Community AIDS Network CEO Rick Carlisle. Rick, thanks for being here. We hear a lot about the HIV epidemic in Florida, so how challenging is this fight?
It's a challenging fight. You know, in the 90s, AIDS was an epidemic. AIDS is not an epidemic like it was, but the spread of HIV is at an all-time high.
And that's due to just lack of protection and other factors?
You know, people are complacent because of the drugs. The drugs now, people think
we hear a lot about that cocktail.
Yeah, well, now today it's 1 or 2 drugs that you have to take, but you have to take those on a daily basis, and you know, it's a regimen. But people are complacent. They think you can take a drug and everything is fine, but it's not.
It's not. Now talk a little bit about how CAN has expanded its reach on the Suncoast. You've come a long way.
Well, yeah, we're in our 26th year. We started on East Avenue, and we've expanded now to 24 locations around Florida.
Wow, so reaching a lot of people. Now, as far as 2017, what's the game plan or the strategy moving forward to continue to help people?
What we do, Grant, is we look at the statistics the state of Florida provides us on a monthly basis, and with those statistics is newly diagnosed cases per zip code. And so what we do is we find what we consider hotspots, and we try to locate services in those hotspots. A lot of times we find a provider that's in that location to work with us, but a lot of times we have to move in and do it ourselves.
And as far as the Suncoast area, what is the status report here? Getting better? Same?
Yeah, the status report here is about the same. The problem here is the youth and the over 55 population.
Rick, thank you so much for joining us, and best of luck throughout this year.
Appreciate it.